Good. We do all those specifically. We basically make a cross and then another cross. And that will check all the angles for your extraocular motor. Make sure that they're all fine and intact, and they are. Do you have any hearing aids? Okay, are you hard of hearing? No? I mean, just speaking with you, you've been able to answer all my questions. You seem pretty normal with that, so okay, good to know. And now I'm gonna check your carotid pulse quickly. Okay, and we don't ever use both to press down on your carotids to listen. If somebody does that to you, push them off, because that's the blood supply to your head and your brain. So, really, we don't even, we do this one to make sure that it's palpable, but don't ever let somebody hold this down for too long, or at all. So I can feel it. It's nice, good whoosh there. And with my stethoscope, I'm going to listen to see if I hear a bruit. And what a bruit is if there's plaque or any kind of buildup in this artery, I'll hear like a kind of a whoosh. It's hard to explain, but it's different from just free-flowing blood. And I'll be able to hear it, and that might lead to, some deprivation, blood deprivation to your, circulation in your head. So let me listen. That sounds good. Now the other one. They both sound fine. They sound pretty clear. If it didn't, we would order an ultrasound and then come in, and they would be able to see through and see if you're blocked at all and how much, what percentage you are. And if it's too much, then they go in and clear it out. So now I'm going to listen to your heart and your lungs. I'm going to start here, the right side. I'm going to go over to the left, and I'm going to go down a little. Okay? Okay, sounds good. Can you take a couple of deep breaths for me? Breathe in. Breathe out. Breathe in. Breathe out. Okay. Everything, your lung sound clear. There's no buildup of fluids, accumulation, there's no pneumonia, anything like that. And also we would have already probably seen something like that from your pulse ox. It would have been lower if your breathing wasn't adequate. So everything sounds really clear to me. Your heartbeat sounds like it's getting a little faster. Are you in increased pain? You'd say it's a solid 8, maybe 9. Okay, well then we'll try to hurry up so we can get you some morphine is what we're going to probably go for next, because if nitroglycerin doesn't work, we administer aspirin and morphine next. Because morphine dilates the blood vessels and has your heart work less. And so if there's anything blocking it, then that kind of helps it out, because the arteries and the veins get bigger. And the heart has to work less, and that will usually alleviate your pain. And the aspirin, obviously, for thrombolytic blood clot breaking up effects, that helps us out. So before we really go into more painkillers and strong thrombolytic medications, will at least get you started on that. So basically I'm just going to listen to your bowel sounds, and then I'm going to check the pulses in both of your wrists and in your feet, because I'm just looking, you're in a gown and I can see your legs. There's hair dispersed everywhere it's supposed to be, so that means you have good venous return, and you have hair on your toes, which is good. You should always be happy about that, because it means you have really good peripheral circulation, so don't ever be mad about it. And I can see all that, and we're trying to hurry up. So I don't see any swelling in your legs, anything that would indicate you might have a DVT. There's no pain there. You haven't told me that. Is there any pain in your legs? No, it's all in your chest. Okay. So what I'm going to do is it's very important for me to establish that peripherally, which means your fingers and your toes are getting blood, not just your head and your trunk. Those are kind of easy to fill, but it has to go all the way down your legs to your toes, come back up, all the way down your arms to your fingers and come back up. So I'm going to blanch your finger, and it should come back within, some say 3, some say 2 seconds, but it should fill back up and be pink again pretty quickly. So let me do that first. Good. Both hands. Good. Okay, good cap refill time. That's really important. Okay, now let me listen to your bowel sounds. Just want to make sure that they're active. Good, 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 good. Okay, that's important. It could be, epigastric pain, so we want to, make sure your bowels are working normally and that they're all active. If they're not, then there could be a blockage or some kind of issue. If they're hypoactive or anything but, or hyperactive, there could be an issue. They sound normal to me. So now I'm going to check your pulses. So on your right wrist. Okay. And on your left wrist. Okay. What I'm looking for is I really want to get a good palpable pulse. If you know what you're looking for, it's pretty easy to do. And once I'm there, I want to rate the strength, and I don't want it to be thready and slow or barely, palpable. I want it to be nice and strong, able to feel it. It varies, but we grade it from a 0 to a 4. And a 0 is obviously that you can't find it, and that's very bad. You're not a 0. That is an emergency. If nobody can find it, then we get out in ultrasound to try to find it, and if we can't find it then we have to take emergency measures, because that means that you aren't getting any circulation to past that point. So I can feel both your pulses very nicely. One is weak and thready, and that'll happen if you are really dehydrated. There's not enough volume of blood to really make an impact. So we don't like it when that happens, and that's not the case either. But you have a nice 2 here, where it's strong, I can feel it. And then I'd say there's a 2, and then the 3 is on your left. And that's a really athletic, good, firm pulse that's really easy to find, and you really feel it. And then there's something called a bounding pulse, and that's a 4, and we don't like that. And that can happen if you are overhydrated, if you have a volume overload. If you ever get fluids in the hospital and they go too fast or something like that for your system, and your kidneys aren't working and filtering, and you accumulate fluid, that can happen, and it's literally bounding, it bounces. You can see it sometimes just looking at somebody's skin. So you don't have that. You have a nice 2 and a 3. And then let me check your feet. Okay. And I found your dorsal pulse on both feet, and that's somewhere where it can be pretty hard to find, but I would say you have 2s on both feet, so because it only took me a couple seconds to find it. I know where to look, so if it took me too long, we might have a little bit of an issue, but I found them, they felt nice, so you have good circulation everywhere. So basically I've done a very quick head-to-toe assessment on you. I know what your pain is, I know what your vital signs are, I have a baseline of what you are feeling, what aggravates, what alleviates your pain. And a quick history on if this has happened to you before. I don't have your full medical history, but as time is of the essence, we'll deal with that after we get you some morphine and some aspirin to help try to alleviate this 8 and 9 that you're talking about, because really I can't get an accurate history from you if you are too overwhelmed by the pain. So let's try to get you out of pain, and then we can move on with the assessment and your medical history. All right, see you soon.